I'd like to ask for your permission to use this video for educational purpose and on internet.
Yes, you can.
Thank you. Now tell me about what were your symptoms before the surgery?
Back would go out at least once a year in the fall where I couldn't get off the floor. The pain was excruciating when the back would go out, and couldn't hardly do anything.
Yeah. And we, after put you through to all our protocols, we decided that the bottom two discs were responsible for your symptoms. And we did that surgery about 4 or 5 months ago. And this is the pictures that we have. And we did a L4 to S1 OLLIF. That did you stay in the hospital after the surgery?
A couple hours.
Couple of hours. You just then, did you walk home after that?
I walked out of there right after the surgery, or
Okay.
a few hours after.
Yeah, and and the surgery, we did it actually in just 60 minutes, 1 hour. And our blood loss was, I'm looking at that, 59 cc, which is practically about 2 ounces, which is nothing for a 2-level procedure. Now, you're not one of our best results because you had that nerve root irritation, and that is why I'm getting this testimonial for you, because you described it very well how it was. Tell me about that nerve root irritation.
The nerve irritation was at first very painful with the shooting pains through the toes, the nerves through the toes.
On the left side,
on the left side only, and the weakness in the leg. Very sensitive to touch, where it was I could hardly put socks on.
Yeah, and that was because we had to actually push a nerve away to get inside of the disc base. And how has been going with that symptoms you just described?
The sensitivity is not near as bad as it was at first. It's still sensitive. It's day by day, week by week. Every week something else changes a little bit.
So overall it's getting better.
Overall it is getting better. Sensitivity is not so bad. Standing up is not so bad. But
okay, now you told me as well about that considering that the surgery wasn't that long ago. So you said that you had some other friends or...
I was sitting with 2 other friends of mine that have had back surgeries. One was over 7 months ago, and the other one, he had a surgery many years ago.
So, if you compare them...
If I would compare them 2 surgeries to mine, I would say I'm leaps and bounds ahead of where they are at this time.
Okay, and I think we see as well that we actually had a study. We studied what is the rate of nerve irritation after open surgery. Interestingly, the rate of nerve irritation after open surgery was 50% higher. But I see it again and again that those patients are, for months and months, they feel so miserable. Some numbness or sensitivity on the top of the foot is their least problem, whereas with our patient, that is all what's remaining, and that's what patient talk about. What did your friends after open surgery tell you about their symptoms? Can you describe them?
Extreme pain in the back, not at all what they advised to do.
Yeah.
That, to give it a percentage, I would say I'm 60 to 65% where I'd want to be at. To where I can go back to doing normal everyday things.
And that is a very realistic, expectation that within the next 6 months you will be there where you want to be. Now, obviously, still there are some limitations that your body tells you, but I think we are on a very good path. Even though, again, you are not one of our best results because you had that nerve root irritation. Any comment?
I don't have really anything bad to say about it at all. I feel a lot better than I used to.
Okay, well, thank you very much for the interview.